Ladies and gentlemen, welcome back to another episode of the Behind the Counter Show. I am here today with the incomparable John Belidi, our compounding pharmacist, and also my father. And today we are talking once again about low dose naltrexone. Now, we actually got a lot of hits and a lot of people asking questions on LDN from our last video, so we thought it might be a good idea to do a follow-up and talk about some specific questions that we get a lot related to LDN. And today, specifically, we're going to be talking about titration, which is essentially starting with a lower dose and ending up with a higher dose, or what your ideal dose is supposed to be, correct?
Yes, we've been getting a lot of questions about the right dose and exactly why you start where you do, and it's all about titrating to the right dose. Very important. So
what exactly is the right dose then, and how do you get there?
Well, again, great question. I think it's easier to answer where you start. Where you finish for everybody else is different.
Okay,
so,
fair enough.
We generally...
That's what compounding is all about, right?
Yes, absolutely. Tailoring it to individual patients. So we like to start patients at 0.5 milligrams.
Okay.
And, we go up incrementally in somewhere between 0.5 and 1 milligram increases and in increments, and we titrate up.
Okay. How long would that take exactly then if you're doing this? It sounds kind of slow, no?
Well, I think when you're talking about LDN therapy, it's very important to be patient. Easy for us to say on the side as a practitioner and the pharmacist, but as a patient, sometimes I know it's difficult, but you do need to at least give it a minimum of 2 months, and oftentimes I recommend at least 6 months,
Oh, wow, okay. So a decent amount of time, some patience that's required on the patient's end. I guess,
right, exactly.
So interesting. So you're starting really low at 0.5, and again, titration is you're going up to some amount. Do you know in general, like kind of a common number, or where people end up?
So the typical number people target is 4.5, but I think that sometimes picking a target dose like that for something like naltrexone isn't always the best thing to do. I think you got to. It's an individualized thing, so you want to start at the 0.5, and where you end up might be somewhere between 3 and 4.5 milligrams, I think,
Okay.
But again, so you want to titrate up over, let's say 2 months to that target dose, whether it's 3 milligrams, 4.5 milligrams. And then after that, even still, I would say, again, be patient and stick with your therapy for several months.
Okay, but you're compounding this medication custom for me or for whomever, right? So how do I, and these are capsules, right? So then how do I go about making sure I'm doing this dose? Are you making a custom medication every time, I guess?
So what we do is at HB Pharmacy, we make titration kits. So you will have a starter kit, and then you'll have a continuation kit, and then that'll take you through your first 2 months. After that, and those give you flexibility to adjust your dose. After that, then you're going to, we're going to see how you're doing. We're going to work with your practitioner, and we'll figure out what's the best dose for you, and then you'll have one single capsule or dosage to be able to take. We can also make a liquid too. So if you want to take 1 ml, 1.5 mLs, that type of thing, sometimes we'll make that for a patient too. Again, whatever's easier for the patient to handle.
Okay, so we've talked about what titration is. We've talked about how low we're even starting, and kind of in general, even though it's individualized and it's going to vary person to person, what we're going up to. Why do we need to do this? Because, correct me if I'm wrong, the commercially available naltrexone is 100 milligrams or something like that. So
50 to 100. Yeah,
50 to 100. Okay, so this going from 0.5 to 3 or to 4.5 or whatever, that seems minuscule percentage-wise compared to what's commercially available. Why do we want to spend so much time and effort doing this?
That's an excellent point, very fair, and not surprising that you would make that observation, being with the math and engineering background that you have.
Not a pharmacist.
So what happens is that everybody has a different target dose, and if you just start a person, for example, on 4.5, which is where they may end up eventually, you may miss the dose and end up giving too much medicine.
Okay.
And then the patient doesn't feel right or doesn't feel the benefits, and then as a result they end up discontinuing the therapy. So we don't want a patient to get to that point. We would rather take a little bit more time and make sure that we're targeting the right dose. And so, yes, it's a little bit frustrating at the beginning for the patient, but it's better off because sometimes we find that if you jump to the 4.5 right out of the gate, you end up stopping, and then you're losing the benefit.
Side effect related too, I guess.
Yeah, I mean, it's a very well tolerated medication overall. So side effect wise, most common side effect is vivid dreams, honestly.
Okay.
But some people it just doesn't agree with properly, and if you jump up to 4.5 right from the start, we find that sometimes people just don't do well. So it's better to titrate up. I think it's the best way to do that.
Gotcha. Okay. Sorry.
You know, because even at a smaller dose, you can take too much. You know, so it's better to figure out where, you know, the way this medicine works. It's not an anti-inflammatory drug like a steroid or like a non-steroidal like Motrin, but it does help your body decrease inflammation.
Right.
Right. So, and it also increases your production of endorphins. So, you don't want you need to, you know, handle that in a methodical, you know, kind of way.
Okay. This seems like a lot to keep track of, and obviously working in a pharmacy, medication adherence is a challenge for patients sometimes, and the more complicated something can be, I would assume the less adherent patients might be to the therapy, whatever it is, LDN or otherwise,
Sure.
right? So what can we do, or what do we do to help patients stay adherent or try to simplify some of this titration process?
Well, other than providing the titration kits and working closely with your practitioner to make sure we're getting, and of course the patient to make sure that we're getting you the right dose, I also recommend some other practices such as keeping a diary of your symptoms. So. Okay. Because you don't always know how you're feeling, and too often times, and I've said this before, you take something like this for 6 months or even a year, and all of a sudden you say, I don't really know that this is working. You stop it. It's only then that you realize, I think it was working. So
Sure.
if you start keeping...
You've heard that from patients a few times.
Absolutely, yeah.
Anecdotal, but still.
Yeah, absolutely. So if you instead keep somehow track your symptoms, like how you're feeling with your musculoskeletal system, how you're feeling with fatigue, or things like that, then you would then be able to look at that and say historically, yes, this is I was doing here okay on this dose, or this is when I changed to the higher dose, and then these things happened. So sure. you somehow have to kind of track that.
Okay. There's got to be. I mean, this is a newer thing, right? But I have a baby now. We have trackers for our baby and formula. Like if for me, more commonly in the nutrition world, there's things to track nutrition. Is there an app or something that people can use for this kind of stuff?
So there's for people that are more old school, like your father, you can get a PDF and then there's just a chart. You can just write.
It's downloadable.
Downloadable, yeah, and we can post that now. And you can see that and download the PDF, and then you can just track. Okay, this is June of 2024, and this is how I was feeling in the first. And every day you can write something if there's something of note. There are also apps. So the symptom tracker called Simple. The symptom tracker is another app that can be downloaded, and that you do all through your smartphone, which makes it easy, and it's all in one place, and it's easy to find. So rather than having a lot of pieces of paper around, sometimes these days it's easier to keep all that information in your phone. Then you can better know how you're feeling and where you're doing okay. And also on the back end, it also makes you realize, hey, this is really, it's great that I'm keeping track of this because I'm actually feeling better,
Okay. Yeah. No, that's great. We can include the links to all of those things in the video as well, in case anyone's interested in downloading those and checking them out. But yeah, okay. So if now this is kind of titration in general, just to recap some of the benefits too. And before we get to the benefits, do you have any advice for patients who may be impatient as it relates to this? Like, this might take a few months before you get to the actual thing you're going to start treating. That can be a long time for people who may want relief, ASAP.
Exactly, and understandably, right? When you're not feeling well, you go to the doctor. Something like a blood pressure medicine, for example, gets you under control pretty quickly. So it's difficult for a patient to understand or accept that things take time. But with inflammation and the process in the body that goes through, it didn't take you 2 months or 6 months, which is what we're asking you to wait, to get to the state where your body was inflamed in some capacity and you were getting experiencing some sorts of illness that LDN could help. So what I would ask you to do is be patient, because it didn't take you that long to get to that point. So you shouldn't expect to get it all fixed in that quickly. You know what I mean?
Yeah. Same with weight loss, kind of, right?
Right.
Didn't take you 5 days to gain 20 pounds, so probably not going to take you 5 days to lose 20 pounds.
Exactly, yeah. So LDN helps you reverse chronic inflammation, and inflammation drives disease. So you want to reverse that, takes time. So you just need to be patient.
Okay.
You know?
And we did a longer video on the general benefits of LDN too, so definitely check that out, which is on our channel as well. But do you want to just give a quick recap summary of those benefits for LDN before we
Sure.
wrap up?
Yeah. No, it's a good idea. So. You know, like I was just saying, LDN reduces inflammation, and as we age, you know, inflammation can, you know, make your aging less optimal, right? So I call it inflammaging. You know, I don't actually call it. That's like something some of the people that are doing that have coined that term. So you want to, you know, stop or reduce the inflammation so that you don't age in a suboptimal way. So, you know, that's one thing to promote healthier aging. You know, it also helps
inflammaging. Is that what you said?
Inflammaging. Yeah. So instead of inflammation, inflammaging. So it's you know, it's like a little play on words. So there's that. There's also the, you know, the overall sense of well-being you get because it increases your body's production of about over three times what it normally would be of your endorphins. And then, you know, we also know that because it's helping work on inflammation, it helps, you know, with you know, chronic pain and stuff like that. So those are real three big benefits, you know.
Sure. Okay. Cool. Thanks for sharing.
Sure.
And thanks everyone for joining us at home as always. If you have any questions about LDN or anything else, please give us a call at 201-997-2010. And again, John is a compounding pharmacist. We are a compounding pharmacy, so we make medication like this specifically for individual patients. But of course, all of these things that we talk about, well, LDN specifically in this case, require a prescription. So if you're new to LDN, you want to learn more about it, we'd be happy to point you in the right direction. But ultimately, you'll need to speak with your provider about this kind of stuff as well to make sure it's right for you. And if you don't have one, we do know some physicians that we can point you to. Who
Absolutely, yeah. Well. No, there's no substitute for a one-on-one consultation with your practitioner. And this general information, you know, certainly is a help to get you started and give you some guidelines and general, you know, idea of what to do. But always make sure you check with your practitioner.
Absolutely. Thanks a lot, everyone.
Thanks.
We'll see you on the next one.